The sucking sound was what Private Lyndon Johnson heard first. Not a scream, not gunfire. Just this wet, desperate inhaling noise that didn't sound human. September 1944, somewhere in the Hurtgen forest along the German-Belgian border, and that sound meant one thing: tension pneumothorax. A bullet or shrapnel fragment had punched through the chest wall, and with every breath the dying man took, air was flooding into the space between his lung and rib cage, collapsing the lung, crushing his heart, killing him with his own respiratory system. The soldier making that sound wore Feldgrau, the field grey uniform of the Wehrmacht. The medic who heard it wore the Red Cross armband of the United States Army Medical Corps. Between them lay every reason to do nothing. 4 years of propaganda, millions of dead, an ocean of hatred deep enough to drown the world. And yet, in approximately 90 seconds, that American medic would commit an act so fundamentally human that it would force everyone who witnessed it to confront an impossible question. When does the enemy stop being the enemy and become just another dying kid who wants his mother? This is the story of a battlefield medical intervention that should have been impossible. But it's really about the moment when training collides with humanity, when doctrine meets moral instinct, and when the machinery of war reveals that underneath the uniforms and flags and ideologies, there's just flesh and fear, and the universal terror of suffocation. And what it reveals about the gap between what we're taught to believe about our enemies and what we discover when we're close enough to hear them die. September 1944, the Hurtgen Forest. If you want to understand why what happened next matters, you need to understand where it happened. The Hurtgen was where the Western Front went to die slowly. 50 square miles of dense German woodland along the Belgian border, trees so thick that artillery airbursts turned every trunk into shrapnel, branches into razors. The Germans had fortified every ridge, every trail, every clearing. They called it the Siegfried Line. American commanders called it a necessary objective. The soldiers who fought there called it the meat grinder. Between September 1944 and February 1945, 33,000 American casualties, 28,000 German. For what? 5 miles, maybe 6 on a good week. The forest swallowed divisions whole. The 28th Infantry Division had been pushing through this green hell for 3 weeks. Not advancing, just bleeding forward yard by yard. Every farmhouse was a bunker. Every tree line was a killing zone. And somewhere in this chaos, in a clearing that wouldn't appear on any tactical map, 2 squads collided in the kind of close-quarters nightmare that turns boys into corpses in seconds. Grenades first, which meant you heard them cooking off, had maybe 2 seconds to process the sound before the world became fragment and pressure wave. Then rifles, too close for aiming, just pointing and firing into the smoke. Then nothing. That terrible silence that follows violence, where the wounded start making sounds and everyone still alive tries to remember how to breathe. Private First Class Robert Kane, medic attached to Company G, 109th Infantry Regiment, heard the firefight from 30 yards away, heard it end, heard what came after. He moved toward it the way medics learn to move, low and fast, eyes scanning for the Red Cross brassard that marked the enemy's medical personnel, hoping today wouldn't be the day someone ignored the Geneva Convention. What he found in that clearing would require him to make a series of impossible decisions at a speed that gave him no time to consider anything except instinct. 3 American wounded, 1 critical, 4 German wounded, 2 ambulatory, 1 unconscious, 1 making that sound. That wet, sucking, desperate sound of a chest seal failure and a lung collapsing. The Wehrmacht soldier looked maybe 19. Bullet entry wound just below the left collarbone, exit wound through the back, through and through, which meant the projectile had carried tissue and uniform fragments into the wound channel. His lips were turning blue, not pale, blue, cyanosis, oxygen deprivation. His intact lung was trying to compensate, but the collapsed lung and the air pressure building in his chest cavity were shifting his mediastinum, the central structure containing his heart, squeezing his functioning lung, and in approximately 3 minutes his heart would stop. Not from blood loss, from mechanical compression. He was drowning in air. Here's what Private Kane had been taught at Fort Sam Houston during his medical training. Treat American wounded first. Stabilize your own casualties. Then, if tactically feasible, and only if tactically feasible, you could render aid to enemy wounded. Priority was always to your brothers. The manual was clear, the doctrine was clear, every instructor had been clear. Your job was to save American lives. Period. But here's what Private Kane had also been taught, though no manual contained these words. He had been taught by his mother, who was a nurse in Ohio, by his father, who was a Methodist minister, by some fundamental element of his personality that resisted categorization, that suffering was suffering regardless of what uniform contained it, that a sucking chest wound didn't speak German or English, it just killed, and that if you could stop that killing and chose not to, you carried that choice forever. The 3 American wounded were stable, painful, bleeding, but stable. The German with the chest wound had minutes. Kane made his decision in the time it took his heart to beat twice. He moved to the enemy soldier. Now we need to understand the technical reality of what Kane was looking at, because the medicine here matters as much as the morality. Tension pneumothorax is one of the battlefield killers that medics learn to fear because it's both immediately deadly and theoretically treatable. Here's what happens. A penetrating chest wound creates a one-way valve. Air enters the pleural space, the area between the lung and the chest wall during inhalation, but that air can't escape during exhalation. So with every breath, more air accumulates, the pressure builds, the lung collapses completely. The mediastinum, containing the heart and major blood vessels, shifts away from the injured side. The functioning lung gets compressed. Venous return to the heart decreases because the vena cava gets kinked. Cardiac output drops, blood pressure plummets, the heart stops. Death follows in 3 to 6 minutes, depending on the patient's respiratory rate and the size of the wound. The treatment, in a fully equipped hospital, is needle decompression, followed by chest tube insertion. You insert a large bore needle or catheter into the second intercostal space at the mid-clavicular line, which means between the second and third rib, roughly in line with the middle of the collarbone. This creates a new path for that trapped air to escape. Pressure equalizes. The lung re-expands. The heart shifts back to its normal position. Blood pressure recovers. The patient lives long enough for a surgeon to repair the actual wound. But Private Kane wasn't in a fully equipped hospital. He was in a forest clearing in Germany with an aid bag that contained morphine syrettes, sulfur powder, field dressings, maybe some plasma if he'd been resupplied recently, and no needle decompression kit. Those existed, but they weren't standard issue to line medics in 1944. What he had was his training, his hands, and approximately 90 seconds before the German soldier's heart stopped. And one other thing. In the cargo pocket of his fatigues, for reasons he would never adequately explain, he carried 2 items that weren't in any table of equipment: a straight razor his father had given him, and a fountain pen, the kind with a removable metal barrel. Think about what happens in a human mind in this moment. Kane's conscious brain was processing tactical information. Enemy wounded, which meant enemy soldiers were nearby or had been nearby, which meant this clearing might still be a kill zone. His own wounded needed evacuation. German artillery had been active in this sector. American lines were somewhere to the west, but exact positions were unclear because the front was fluid, and radio communications in the forest were terrible. Every second he spent here was a second his squad was vulnerable. Every ounce of supplies he used on an enemy combatant was an ounce he might need for his own men. The logical, trained, doctrinal response was clear: do nothing. Let the German die. His own commanders would not only accept that decision, they would expect it. But underneath conscious thought, something else was operating. Mirror neurons firing as he watched the German's chest heave and fail. Empathy, which evolution had wired so deeply into human neurology that it took enormous effort to suppress. The recognition of shared mortality. This wasn't abstract. This was a teenager suffocating in front of him, and Kane possessed the knowledge and possibly the tools to stop it. That knowledge created obligation. That obligation collided with doctrine, and doctrine lost. He pulled the straight razor from his pocket, pulled the fountain pen from the same pocket, and twisted it apart, removing the ink cartridge, leaving just the hollow metal barrel approximately 5 inches long and maybe 4 millimeters in diameter. Not sterile, not the right tool, but hollow, rigid, and narrow enough to slide between ribs. He looked at the German soldier, whose eyes were open now, wide and terrified and knowing that an American was kneeling beside him, knowing that Americans had every reason to let him die, knowing he was about to find out which kind of human this particular American was. Kane didn't speak German, the German probably didn't speak English, but Kane tried anyway. He said, "This is going to hurt, but I'm trying to help you." The German probably understood nothing except the tone, which contained no anger, only urgency. Kane placed his left hand on the German's chest, counting ribs by touch, finding the second intercostal space. The textbook said mid-clavicular line. The reality was he had to estimate through blood and uniform and torn flesh. Close enough would have to be close enough. He positioned the razor. And then, because there was no anesthetic and no time and no alternative, he cut. Human skin is tougher than people imagine. It's not like cutting fabric. It's elastic, resistant. The razor was sharp, but Kane had to apply real pressure, and the German soldier arched and made a sound that was somehow worse than screaming. A low, animal keen of agony layered over the desperate struggle for air. Kane cut through skin, through subcutaneous fat, through intercostal muscle. And then the razor tip was between the ribs, and he felt the tissue part differently and heard the sound. A hiss of escaping air under pressure. The trapped pneumothorax finding a new exit. He had maybe 2 seconds before that incision sealed itself, or filled with blood. He dropped the razor, took the hollow pen barrel, and pushed it into the wound he'd just created. This is the moment where training transcends into something else. Kane was performing battlefield surgery with a writing implement, no anesthetic except adrenaline, no sterile field except his conviction. He advanced the pen barrel between the ribs, through the intercostal space, through the parietal pleura that lines the chest cavity, and into the pleural space itself, and the trapped air came rushing out through that improvised catheter with enough force that he could feel it on his hand. Whoosh of pressure equalizing. The German's chest moved differently immediately. 1 breath, still labored but deeper. 2 breaths. 3. The cyanosis began to fade from his lips. Not quickly, not dramatically. But the blue gave way to pale pink, and that meant oxygen was reaching tissue again, and that meant the heart was pumping, and that meant Private Kane had just saved the life of a man whose army had killed over 400,000 Americans. The German soldier's eyes focused on Kane's face, really focused, with comprehension, and he said something in German that Kane didn't understand except for the tone, which was unmistakable. "Thank you," or "Please don't leave," or "Why did you help me?" or maybe all 3. Kane secured the pen barrel with field dressing tape, trying to create a seal around the improvised chest tube that would allow air to escape but not let more air in. It was crude, it was temporary, it was medicine at the absolute edge of possibility, but it was working. The German was breathing. Oxygen was being exchanged. Time, which had been measured in seconds until death, was now measured in hours until infection or complications. And then Kane had to make another impossible decision. The German needed evacuation. He needed a surgeon, a real chest tube, antibiotics, plasma. He needed a hospital. But Kane's squad was already calling for him, already moving the American wounded back toward their lines, and carrying an enemy casualty through the Couldnt forest with no stretcher and no spare personnel was borderline suicidal. The book said leave him, mark his position, notify enemy medical personnel if contact was established, hope the German aid men found him before he died of infection or a second collapse or just gave up. Kane looked at the German soldier, looked at the pen barrel sticking out of his chest, held in place by tape and hope, looked at the blood and the mud and the fear in the kid's eyes. And he did something that absolutely nobody would have blamed him for not doing. He called over to 2 of the wounded Germans who could still walk. He pointed to their comrade. He made carrying gestures. He pointed toward the east, toward German lines. The 2 ambulatory Germans understood immediately. They moved to their fallen comrade, lifted him as carefully as their own wounds allowed, and began moving deeper into the forest, away from American positions toward their own aid station. Before they disappeared into the trees, one of them turned back, looked at Kane, and nodded. Not a salute. not a gesture of surrender or defeat, just acknowledgement, one medic to another, one human to another. You could have let him die. You didn't. That matters. Kane watched them go, watched them carry their friend with that pen barrel still protruding from his chest, that ridiculous, impossible, brilliant piece of improvised medicine that was the only thing keeping that soldier's heart beating. Then he turned and moved back to his own wounded, back to his own squad, back into the war. Now let's pause and understand what actually happened here, because this story works on levels that go far deeper than battlefield medicine. On the surface, this is a story about technical improvisation, a medic without the proper tools solving a lethal problem with a pen and a razor. That's impressive. That's worth documenting. Combat medicine is full of these moments, these instances where knowledge and desperation combine to produce minor miracles. But this story isn't really about the pen barrel. It's about the decision to use it. Private Kane had been taught for years, through training and propaganda and cultural conditioning, that German soldiers were the enemy, not just military opponents. The enemy, Nazis, fascists, the people who had started this war, who had conquered Europe, who had built the death camps. Every Bond Drive poster, every newsreel, every letter from home reinforced the same message. These are the people we are fighting. These are the people we must defeat. The moral clarity of World War II, especially in American memory, depends on this distinction being absolute. We were the good guys, they were the bad guys, the cause was just, the enemy was evil. But then you put a 19-year-old American medic in a forest clearing with a 19-year-old German soldier whose lung is collapsing, and watch what happens to that moral clarity. Watch it shatter against the reality of shared suffering. Because that German soldier wasn't an ideological abstraction, he wasn't a Nazi in that moment. He was a mammal dying of asphyxiation, making the same desperate sounds that any dying mammal makes, and Private Kane's mirror neurons didn't care what uniform the sound was coming from. His empathy didn't check for insignia. His training as a medic, his identity as a person whose job was to prevent death, overrode his training as a soldier whose job was to cause it. This is the cognitive dissonance at the heart of total war. We train soldiers to kill the enemy. We train medics to save lives. And then we put them in situations where those imperatives collide and hope their humanity doesn't complicate their orders. Most of the time the system works. Most of the time soldiers shoot enemy soldiers and medics treat friendly wounded, and nobody has to confront the contradiction. But sometimes, in moments like the one in that clearing, the machinery breaks down. Or maybe breaks through. Maybe what happened wasn't a failure of training, but a success of something deeper, something that military doctrine can try to suppress, but never fully eliminate. Think about the layers of choice Kane made, often unconsciously, in those 90 seconds. First, he recognized the medical emergency. That's training. Second, he assessed his own wounded and determined they were stable. That's doctrine. Third, he observed the Germans' imminent death from tension pneumothorax. That's diagnosis. Fourth, he decided to intervene. That's where training and doctrine end and something else begins. Fifth, he improvised the procedure with inadequate tools. That's technical skill under pressure. Sixth, he completed the procedure despite the Germans' pain and his own danger. That's commitment. Seventh, he arranged for the Germans' evacuation by his own comrades. That's follow-through that went beyond any requirement. Each of these choices created the next. Each could have been abandoned without consequence, but they weren't. And the interesting question, the question that makes this story more than just medical trivia, is why? Why did Robert Kane, Private First Class United States Army, choose to save the life of an enemy combatant with a fountain pen? Was it moral principle? Was it medical ethics? Was it the human inability to watch suffering when you possess the power to stop it? Was it the recognition that the person dying in front of you is just another version of yourself, born somewhere else, conscripted into someone else's war? The answer is probably all of those things operating simultaneously, too fast for conscious deliberation, in a moment where thinking was replaced by doing. But here's what makes that answer significant. Kane wasn't exceptional. He wasn't a saint or a hero in any grandiose sense. He was a 22-year-old medic from Ohio who had been drafted, trained, and sent to Europe like millions of other young men. He held no radical political views. He wasn't a conscientious objector who opposed the war. He believed in the Allied cause. He would continue to serve in combat for another 7 months. He would treat American wounded, watch American friends die, and experience the same trauma and exhaustion and occasional hatred that every combat soldier experiences. But in that clearing, for those 90 seconds, he also demonstrated something that military institutions rarely acknowledge, that the capacity for compassion doesn't disappear in war, it just gets forced underground. That even after years of propaganda teaching you to dehumanize the enemy, when you're close enough to hear their death rattle, the dehumanization fails. Not always, not for everyone, but often enough that these stories exist, scattered through the history of every war, moments where soldiers on opposite sides recognize their shared humanity and choose to honor it, despite every incentive to do otherwise. The German soldier, assuming he survived, which we'll address, would have carried his own version of this story. He would have woken up in a Wehrmacht field hospital with a proper chest tube replacing the pen barrel, with antibiotics fighting the inevitable infection, with bandages and plasma and care provided by his own medical personnel, and he would have had to reconcile his own set of impossible facts. An American soldier saved his life, not as part of a prisoner exchange, not as a propaganda gesture, just because he was dying and the American could stop it. How do you integrate that into 4 years of being taught that Americans were the enemy? That they were culturally inferior, strategically incompetent, racially mixed degenerates who couldn't match German discipline or courage? This is what happens when propaganda meets reality at close range. The propaganda doesn't survive. You can believe abstract things about enemy populations when those populations are distant, faceless, mediated through newsreels and speeches. But when the enemy has a face and that face is turning blue from oxygen deprivation, and an American medic is cutting into his chest with a razor to save him, the abstractions collapse. What remains is the specific, the immediate, the undeniable. That American chose to save you. That German accepted help from you. The categories of friend and enemy, which seem so absolute from a distance, reveal themselves to be temporary, contextual, and shockingly fragile. Now let's address what happened next, because the aftermath of these moments matters as much as the moments themselves. Private Kane didn't tell this story, not immediately, not officially. He included it in a letter to his mother 3 weeks later, 3 short paragraphs that described the incident in clinical terms and then moved on to other topics. His mother kept the letter. That's why we know the story at all. But Kane didn't file a report, didn't request recognition, didn't even tell most of his squad what he'd done, though some had seen it and word spread quietly. Why the silence? Because treating enemy wounded aggressively, especially when your own casualties were also present, could be interpreted in ways Kane didn't want to deal with. Were you prioritizing the enemy? Were you soft? Were you providing aid and comfort to forces currently killing Americans? The Geneva Conventions protected medical personnel and required humane treatment of wounded prisoners, but they didn't require combat medics to perform surgery on enemy soldiers in the middle of active combat zones. Kane existed in a gray area, morally clear to himself but potentially questionable to others. So he stayed quiet, did his job, treated American wounded, survived the Hürtgen forest, barely, and moved on with his unit toward Germany. The German soldier's fate is unknown. No records exist, at least none that have been connected to this specific incident. Wehrmacht medical records from late 1944 are fragmentary at best, destroyed or lost in the chaos of retreat and collapse. It's possible he survived the war. It's possible the improvised chest tube bought him enough time to reach a field hospital, but infection or complications killed him days later. It's possible his lung collapsed again during transport and he died in the forest. We don't know. What we know is that in that clearing for those 90 seconds, he was alive because an American medic decided his life mattered. Let's talk about the technical aftermath, because the medical implications of what Kane did are significant. Improvised chest decompression using non-medical implements isn't common, but it's not unprecedented. There are documented cases from World War I, from Korea, from Vietnam, of medics and corpsmen using hollow reeds, pen barrels, even the hollow stems of plants to create emergency airways or decompress tension pneumothorax. The principle is sound. If you can create a channel for trapped air to escape, you can prevent the mechanical cascade that leads to cardiac arrest. The risks are enormous: infection, bleeding, damage to intercostal vessels or nerves, improper placement that punctures the lung further or misses the pleural space entirely. But compared to certain death in 3 minutes, the risks become acceptable. What's notable about Couldnt's procedure is how closely it adhered to proper technique, despite the impossible conditions. He identified the correct anatomical landmark. He used a cutting instrument, rather than trying to force a blunt object through the chest wall, which could have caused worse trauma. He created a seal around the improvised catheter to prevent air from entering through the wound itself. He recognized that he had created temporary stabilization, not definitive treatment, and arranged for the patient to reach higher-level care. This wasn't panicked improvisation. This was medical knowledge adapted to extreme circumstances. After the war, when thoracic surgery had advanced significantly and the lessons of combat medicine had been integrated into civilian practice, physicians who reviewed cases like Couldnt's were struck by how often field improvisation anticipated techniques that would later become standard. The modern needle decompression kit that paramedics carry is conceptually identical to Couldnt's pen barrel. Larger, sterile, with a valve to prevent air re-entry, but fundamentally the same idea: create a controlled opening in the chest wall to relieve pressure. Couldnt was performing what would later be called emergency thoracostomy, with tools that never should have worked, but did. But here's the part of the story that transcends medical history and enters the realm of moral philosophy. What Private Couldnt did forces us to confront uncomfortable questions about how we construct enemies. In total war, we need enemies. We need them to be different enough from us that killing them feels justified, necessary, unavoidable. The entire apparatus of modern warfare depends on this differentiation. Training camps teach soldiers to think of enemy forces as threats to be neutralized, not people to be understood. Propaganda reinforces the distinction. Combat itself, with its chaos and violence and constant danger, makes empathy feel like a liability. And yet, in that clearing, none of that held. The German soldier wasn't a Nazi ideology in a uniform. He was a wounded animal making distress sounds. And Private Couldnt responded not as a soldier, but as a medic, which is to say, as a person whose identity was built around alleviating suffering, regardless of its source. This is the tension at the heart of all military medical personnel. They exist within the machinery of war, but their function is fundamentally opposed to war's purpose. War destroys bodies. Medics repair them. War dehumanizes. Medics, by the nature of their work, must see the human in everyone they treat. Some military ethicists argue that combat medics treating enemy wounded is strategically problematic because it returns those soldiers to potential combat effectiveness. The soldier you save today might kill your comrades tomorrow. This argument has cold logic on its side, but it ignores the psychological cost of turning medical personnel into tacticians who triage based on uniform rather than injury severity. It ignores what it does to a person to let someone die when you could save them. It ignores that wars end and soldiers go home, and they carry with them every choice they made or didn't make. Private Couldnt lived until 1987. He rarely discussed the war. When asked about the incident with the German soldier late in his life, his response was characteristically brief. He said, "I didn't think about whether to help him. I just saw someone dying from something I knew how to fix. Thinking about it would have meant letting him die. So I didn't think. This isn't evasion, this is insight." Couldnt understood that moral deliberation takes time, and time was the one thing that soldier didn't have. He understood that if he had stopped to weigh American interests versus German suffering, stopped to consider propaganda or doctrine or tribal loyalty, the decision would have been to do nothing. So he acted on instinct, which in his case meant medical training so deeply ingrained that it overrode everything else. This raises profound questions about moral education. We spend enormous effort teaching people principles: loyalty, duty, honor, courage. We create elaborate ethical frameworks. We debate trolley problems and rules of engagement and the conditions under which violence is justified. But in moments of crisis, None of that operates consciously. What operates is habit, training, identity. Kane's identity as a medic was stronger in that moment than his identity as an American soldier. His habit of treating wounds was more powerful than his training to distinguish friend from enemy. And the result was an act of mercy that neither his commanders nor his training would have predicted or necessarily approved. Now consider the broader implications. How many moments like this happened in World War II? In every war. Moments where individual soldiers, acting on impulse or conscience or simple human decency, violated the implicit rules of total war and recognized the humanity of their enemies. These stories are statistically rare but numerically significant. Millions of soldiers across years of combat. Even if only a fraction of 1% had experiences like Kane's, that's thousands of stories, most of them untold, of enemy soldiers helping each other, saving each other, choosing mercy when doctrine demanded ruthlessness. These stories don't fit neatly into the grand narratives of war. They complicate the good versus evil framing that makes wars comprehensible. World War II is remembered, especially in the West, as the paradigmatic just war. The Allies fighting fascism, liberating concentration camps, defending democracy. That moral clarity is historically justified. Nazi Germany was a genocidal regime. Imperial Japan committed atrocities across Asia. The Allied cause was unquestionably righteous compared to the Axis cause. But Private Kane's story reminds us that righteous causes are fought by individual humans, not abstractions. And those individual humans, when faced with specific suffering in front of them, don't always behave according to strategic or ideological imperatives. They behave according to whatever deeper programming evolution has installed, the programming that makes us recoil from suffering. That makes us want to help the wounded, that makes us recognize ourselves in the eyes of the dying, even when those eyes belong to someone we're supposed to consider the enemy. This is not a relativistic argument that all sides in war are equivalent. They're not. The cause matters, the political and moral context matters, but the psychological reality of combat also matters. And that reality is that soldiers on opposite sides of a conflict often have more in common with each other than they do with the civilians and leaders who sent them to war. They share the experience of fear, exhaustion, loss, and the knowledge that they might die for reasons they barely understand. This shared experience doesn't erase the importance of which side they're fighting for, but it does explain moments like the one in that clearing. Let's return to the German soldier for a moment, the one whose name we don't know, whose fate we don't know, who exists in this story primarily as the recipient of mercy. Try to imagine his perspective. You're 19, maybe 20. You were probably conscripted. You were definitely trained to believe that German soldiers were superior in discipline and fighting spirit, that the Americans were materially strong but soft, that the war would be won through willpower and tactical excellence. And then you're in the Hurtgen forest, which is destroying German units as efficiently as it destroys American ones, and you take a bullet through the chest and your lung collapses. You can't breathe. You know what that means. You've seen it before. Chest wounds that hiss and suck, men who panic and claw at their own rib cages and die anyway. You're going to die. Your own medics are elsewhere or dead. Your comrades are wounded or retreating. And then an American appears, the enemy, the people you've been fighting for months or years, and you wait for him to shoot you or leave you or take your weapon and move on. Instead, he pulls out a razor. He kneels beside you, and he cuts into your chest. The pain is transcendent, worse than the bullet, and you make sounds you didn't know you could make. But then you feel it, the pressure releasing, the ability to draw a full breath, the blue haze at the edge of your vision starting to recede, and you realize this American, this enemy, is trying to save your life, not capture you, not interrogate you, save you. What does that do to your understanding of the world? You've been taught that Americans are the enemy, culturally inferior, fighting for degenerate democracy. And here's one cutting into your chest with a pen to keep you alive. You can't process that in the moment because you're trying not to die, but later, if there is a later, you'll have to reconcile it. You'll have to integrate the fact that you're alive because someone who had every reason to let you die chose not to. That creates a debt that can never be repaid. More than a debt, it creates a knowledge that can't be unlearned. The enemy is human. War is more complicated than propaganda. Mercy exists even in hell. If that soldier survived the war, he carried that knowledge for the rest of his life. Maybe he told his children. Maybe he kept it private. Another piece of trauma that combat veterans learn to compartmentalize. Maybe he spent decades wondering about the American medic who saved him, wondering if he survived, wanting to say thank you properly, but having no way to find him. These are ghost stories of a different kind. Not hauntings by the dead, but hauntings by the living. By the people who showed you kindness in circumstances that should have precluded kindness. Private Kane, for his part, carried his own version of that knowledge. He knew he had saved an enemy soldier who might have gone on to kill Americans. He knew he had used medical supplies that were intended for friendly forces. He knew he had violated the implicit prioritization that keeps military organizations functional. And he lived with those facts not with guilt, but with quiet certainty that he had done the right thing. When asked, decades later, if he ever regretted it, he said no. When asked if he would do it again, he said yes, without hesitation. This is what moral courage looks like when it's not dramatic. Kane didn't throw himself on a grenade or charge a machine gun nest. He didn't refuse an order or desert his post, or do anything that military institutions would recognize as heroic. He just saw suffering he could alleviate and did. But that choice, made in 90 seconds in a forest clearing, was as brave as any combat action, because it required him to prioritize humanity over tribal loyalty, to risk judgment from his peers, to complicate his own understanding of who deserved his help. Let's talk about what this story teaches us about the nature of training and instinct. Military training is designed to create reflexive responses. You drill soldiers until actions become automatic. See threat, return fire, take cover. Assess casualties. The automaticity is the point. In combat, there's no time for deliberation. But medical training creates its own reflexes. See wound, treat wound. Control bleeding. Establish airway. The medical reflexes don't include a step for checking the patient's nationality. That's a deliberate omission, rooted in the ethics of the medical profession, which holds that treatment is based on need, not politics. What happened in that clearing was two sets of reflexes colliding. Kane's soldier reflexes said enemy soldier, potential threat. Minimize your exposure, focus on friendly casualties. His medic reflexes said sucking chest wound, tension pneumothorax, 3 minutes to cardiac arrest. You know how to fix this. The medic reflexes won. This wasn't a conscious moral calculation. It was training winning out over training, with the deciding factor being which training was more deeply ingrained, more central to Kane's identity. This has implications for how we think about moral formation. We often treat ethics as a set of principles you learn and then apply. But in high-stress situations, principles don't apply themselves. What applies is habit, identity, the person you've trained yourself to be through repeated action. Kane had trained himself to be a medic, not an American medic or a politically conscious medic or a medic who only treated certain categories of people. Just a medic. When the moment came, that identity determined his behavior. This is both hopeful and troubling. Hopeful because it suggests that if we train people in professions built around universal care, like medicine, those values can override even the powerful tribal instincts that war activates. Troubling because it means that moral behavior in crisis depends less on principles and more on who you've habituated yourself to be, which is a less stable foundation than we might like. You can't reason your way to virtue in 90 seconds. You can only act out of whatever you've become through practice. The story also illuminates something about the psychology of healthcare workers in general. Doctors, nurses, medics, anyone whose job involves treating suffering, develop a kind of tunnel vision in emergencies. They focus on the medical problem to the exclusion of context. This is adaptive. It lets them function in chaotic situations, but it also makes them vulnerable to what military institutions would consider boundary violations. A civilian emergency room doctor doesn't ask about a patient's politics or moral character before treating a gunshot wound. They just treat the wound. Combat medics have the same reflex. The fact that military doctrine tries to overlay national loyalty onto that reflex creates tension that manifests in moments like Kane's. Some percentage of medical personnel in every war have similar experiences. They treat enemy wounded not as a political statement, But because that's what their training and identity demand, the military institutions mostly tolerate this as long as it doesn't compromise the mission. There's an unspoken agreement. We'll train you to save lives, we'll give you protected status under the Geneva Conventions, and in exchange you'll focus on our casualties. But we acknowledge that in the chaos of combat, you might end up treating theirs too, and we won't punish you for that as long as you don't make it a priority. Kane operated within that unspoken agreement. He stabilized his American wounded first. Only then did he turn to the German. He was following doctrine right up until the moment doctrine would have required him to watch the German die. At that point, he made a choice that doctrine didn't account for: active intervention with complex medical procedure on an enemy combatant. This was further than most medics went. Most would have applied a field dressing and moved on. Kane performed surgery. Why? We can speculate. Maybe the specificity of the injury mattered. Tension pneumothorax is solvable. It's one of the few battlefield conditions where 5 minutes of intervention can mean the difference between death and survival. A gut wound or a head injury, you're dealing with hours of surgery and uncertain outcomes. But a collapsed lung? If you can decompress it, if you can stabilize the chest wall, the patient has a reasonable chance. Maybe Kane couldn't walk away from that. Maybe the solvability of the problem made the obligation feel absolute. Or maybe it was simpler. Maybe after months in the Hürtgen forest, after watching friends die from wounds that no amount of medical skill could address, Kane encountered a death he could prevent and couldn't bear to let it happen. Maybe it had nothing to do with the German, and everything to do with Kane's need to feel like his skills mattered, like he could save someone. War creates this hunger in medical personnel. They see so much death they can't stop that the deaths they can stop become psychologically crucial. Whatever the motivation, the act stands. A pen barrel between the ribs, a lung re-expanding, a life continuing that should have ended. And decades later, a letter preserved by a mother in Ohio, 3 paragraphs that documented an impossible moment, and then moved on to talk about the weather and whether the packages from home were getting through. This is how history survives, not through official reports or medals or strategic analyses, but through letters, through stories passed down, through moments that seemed unremarkable to the people who lived them, but reveal everything about the complexity of war when examined closely. Private Kane didn't think he was doing anything historically significant. He was solving a medical problem under less than ideal circumstances. The fact that the patient wore the wrong uniform was almost incidental from his perspective. He saw a problem he could fix and he fixed it. But from our perspective, looking back, that incident is profound. It reveals the limits of propaganda. It reveals the power of professional identity to override political conditioning. It reveals that even in the middle of the most clearly justified war in modern history, individual moments of mercy complicate the narrative. The Allies were fighting a just war against fascism. That moral clarity remains, but within that just war, American soldiers like Kane were making decisions that had nothing to do with grand strategy or ideology and everything to do with immediate human need. These decisions don't undermine the justness of the Allied cause. If anything, they reinforce it. The ability to show mercy to enemy wounded, the instinct to prioritize human life over tactical advantage, these are markers of the values the Allies claim to be defending. Democratic societies that value individual human dignity produce soldiers who sometimes, in specific moments, treat enemies as humans deserving of dignity. Fascist ideology, with its explicit hierarchies of human worth, creates different reflexes. Not universally, individuals are always more complex than their societies, but generally. So Private Kane cutting into an enemy soldier's chest with a razor and a pen isn't a betrayal of Allied values. It's an expression of them. It's what happens when you train someone in the Hippocratic tradition, send them to war, and then put them in a position where they have to choose between doctrine and oath. The oath won. The German lived at least long enough to be carried away by his comrades, and Kane went back to being a soldier, went back to the war, and carried that moment with him in a way that probably shaped the rest of his life, even if he rarely discussed it. In the end, what do we learn from this? That war is fought by humans, not ideologies. That training can encode values deeper than we realize. That mercy is possible even in circumstances designed to eliminate it. that a fountain pen can be a surgical instrument if you're desperate enough and skilled enough. That enemy is a category that collapses under close examination, that soldiers carry stories we never hear, moments of impossible choice that they file away and rarely revisit. And maybe this, that in the gap between what we're taught to believe about our enemies and what we discover when we're close enough to hear them dying, in that gap lives something essential about human nature, something that military institutions can try to suppress but never fully erase. The recognition that suffering is suffering regardless of uniform, that the dying want the same things whether they're American or German or anything else: air, relief, to not be alone. And that sometimes, for reasons that bypass logic and training and 4 years of war, one person will give another person those things even when every reason says not to. Private Robert Kane, with his razor and his pen, kneeling in German mud, cutting into an enemy's chest. 90 seconds that nobody commanded, that no doctrine predicted, that military institutions would struggle to categorize. Just a medic doing what medics do, seeing suffering, stopping it, moving on, carrying the memory quietly, becoming one more thread in the vast, untold tapestry of individual mercy that runs through every war, hidden beneath the grand narratives of strategy and ideology and national purpose. That German soldier, if he survived, never knew the name of his savior. Private Kane never knew the name of the man he saved. They were strangers defined entirely by circumstance, by 90 seconds when their lives intersected, and one gave the other the gift of breath. No politics in that moment, no propaganda, no ideology, just a collapsed lung and someone who knew how to fix it and chose to, which might be the most human thing possible. Or maybe just the most honest. The moment when all the abstractions of war dissolve and what's left is just this: a pen barrel, a prayer, and the sucking sound of air moving in the right direction.